What is up, Healthcare Squad? Logan here with Healthcare Stress Relief, the company dedicated to helping you navigate the crazy world of healthcare, doctors, nurses, RTs, paramedics. So many people in the healthcare profession right now, especially because of COVID, are burning out at a rapid rate. And in this video, I'm going to be covering bullying in the healthcare profession, particularly in nurses. Do nurses eat their young? And the answer to this is yes, absolutely. And I think it has more to do with the system issue than just the person being just a bad person, the person doing the bullying. And I'll share a little story with you. When I first started my nursing profession, I was working at a rural hospital. It was kind of like guerrilla warfare. They would almost let you do anything. I was hired as an ICU nurse, but they let me float to the emergency department. Small emergency department, like 8 beds. And there was one nurse in particular, I won't say his name, just an absolutely terrible person. If you look back at it now, he was terribly burnt out, terribly jaded. He was extremely good at what he did. Like if I were to be dying on my deathbed, I would want this nurse to help me. But when it came to cooperating with coworkers, the guy was a bully. And unfortunately for me, he chose to pick on me because I was a new nurse. And I don't know if he felt threatened by me, but he definitely did not like me. When I would ask questions, in one situation in particular, I was asking a question in front of a student, and he's very nice to the students because he knows that they'll go back to their professors and say all these good things about him. But to his coworkers, he was really mean. And one time I asked a question about a clarification, and actually when I look back at it, he had said something, and I had asked him about it. And I said, "Don't you mean this?" And he said, "Why the fuck would you ask me that?" And he just looked super pissed off at me. And then he was very calculated with his words. He would be like, "Oh, I'm just joking with you." But he would do this kind of stuff to all of these people. He would kiss the doctors' asses and schmooze them up so that people would like him. Unfortunately for me, I was so new in my career that I did try and stand up, and I did say some things back to him, like, "Don't talk to me like that." But then he would just ignore me. And there was one day where my coworker Ann and I were working in the emergency department, and all day this coworker ignored us. He didn't say anything to us. He wouldn't work with us or cooperate. And so I go to the nurse CEO, and she basically says, "Oh, this person is great." And unfortunately for me at that time, I didn't have the skills to understand how to navigate this scenario. It really ate at me. And when it comes to bullying in the healthcare profession, it can really tear at you because you just want to show up and help your patients. You don't want to have to worry about walking into work and having to work with somebody that you absolutely despise because they're just a mean person. And so in this video, I created this video to give you a skill set that you can use during these situations. And when it comes to bullies especially, you have to have assertiveness because they prey on your weakness. If you show any weakness or any sign that they're going to get to you, that's exactly what they want. And so you have to be assertive with them. There is a tool, it's called NonViolent Communication, that you can use. This is really good for anything in your life, especially if you want to talk to like your partner or your manager, but this tool will definitely help you. I wish I had it when I was a new nurse. And it's basically a tool to help make sure that you don't put the person on the defensive. And when you are telling somebody these things, when I give you the tool set, just watch and see that how they react. Because oftentimes you can tell a really toxic person is someone who has no self-reflection, no empathy, no sympathy. They will basically point the blame back at you and say you were wrong. And if that's the case when you do use this tool, then that is somebody you need to avoid. Potentially talk with your manager and other staff members. In the end of this story, I actually left this workplace because the CEO and this coworker were toxic. I wish I would have been more assertive, because one of the managers finally reached out to me despite what I had said, and she was like, is this person ever bullying you and all this stuff? And because I just moved on to a new hospital, I didn't want to deal with it. But the problem for me was I should have spoken up. I should have said, yes, this person was a bully, they've done this, this, and this, and then that person would have had to face the consequences. But I was too much of a coward in that scenario, and I just didn't want to deal with it anymore. So learn from me, from my mistakes, speak up. You got to speak up, because their behavior will not end until there are repercussions. And so the tool I'm going to give you, nonviolent communication, the first step is observation. So in the example that I used before, when the person basically cursed at me and all this stuff, I would basically just say, hey, look, nurse, when you said this to me, that's step number one. When you said this, and you basically paint the picture of what they said and try and use word for word, I felt, that's step number two. You tell them how you feel. You never want to tell somebody, you made me feel this way. You want to say, I felt this way when you did this, after the observation. I felt angry and disrespected. The third step is your needs. So I need better communication, and I need somebody to not curse at me when they speak with me, and I need a support system. It's advisable to not use you, like I need you to stop doing this. It's better if you can try and keep it more centered to how you feel and what you need. It'll keep them off the defensive. And then number 4 is finally your request. So would you be willing to be a little bit more patient with me? I know that I can ask a lot of questions and maybe sometimes annoy you, but I just need this. If you bring it back to what you need and what you're requesting, this is a very, very powerful tool. And like I said before, try and stay away from saying you too many times. You made me feel is going to put them on the defensive. So use this tool, practice it. It's absolutely imperative to communication. It's really, really helpful. Once you use it in a conversation, you'll often find that the conversation will develop. So you bring up this instance, and then the person will basically rebuttal with whatever they have to say, and then you can use it again. So if they rebuttal like, you really pissed me off, then you can just ask, okay, well, how did I make you feel? What did you need in that situation? You can flip it and start asking them what they need and what they request. And this will really strengthen your communication with your team. You can teach it to your team, to your fellow staff members. And when you start to use this, you'll notice that people are going to want to come to you and open up to you more. And people who were disrespectful to you, if you start using this and being more assertive and telling them exactly what you need from them, it's going to put them in a position where they're going to have to start changing. And I know there are some people that are just so toxic it's hard to change them, but be the change you want to see. Start by using this tool, start by being a better communicator, and the communication within the healthcare system is going to get much better. So that's all I got for you today. Go ahead and check out my website, healthcarestressrelief.com/busburnout. I have my new bus burnout program. It's in a beta launch phase right now, so the prices are very low. I would advise to jump in because the subscribers on YouTube and the messages I'm getting continuously go up. I have 2 spots at the moment, so if you're interested, just go ahead and book a call with me on either my Instagram or the main page of my website, and we can talk for 30 minutes, see if I can help you in any way, what you're going through, your goals, your values, what you want out of your profession, and we will lead you down a path of more happiness, more fulfillment, and giving you the skill set to drop your stress. The skill set that I'm telling you about is imperative to not only just your work life, but your whole life in general. This is a skill set that you can take with you until you die. and it's something you can practice for your whole life. It will honestly bring you more happiness. It has brought me significant happiness. I had to develop this for myself because I couldn't find anything else on the market. If you are interested, book a call. We have a lot of work to do within the healthcare system, within ourselves, and I'm here to help every step of the way. So reach out if you need any help, and stay strong. I'll talk to you later.